As soon as I got home, I called the surgeon's office and told them what had happened. They were appalled. I asked the surgeon's office secretary to give me the name of a doctor that would give me a referral to his office. They gave me a doctor, Lisa Kiner. It took a month to switch doctors, so by the time I got an appointment with Dr. Kiner, it was the day before the surgery with the surgeon. As soon as I came in, I just asked the question. She looked at my weight on the paper and said, "Let's do it." I was so happy, but then I had to tell her I needed a referral that day, and they usually need about 2 weeks, and she said no problem. My extremely long journey had begun. I went to Dr. O's office the next day, and he was so nice and understanding. He cleared me for the testing part of the surgery, but told me, along with months of testing, he also wanted me to lose 40 pounds. So my diet and seemingly endless testing had begun. This testing included a chest x-ray, ultrasound, breathing test for asthma, never-ending blood test, EKG, echocardiograph, heart monitor for a day, upper GI, upper endoscopy, therapist evaluation, support group meetings, and the dreaded sleep study. On paper, it's not so bad, but this was 6 months of poking and prodding, and most of the places had a 1 or 2 month waiting period just to get an appointment. In August of 2007, I had just turned 20 years old. I went in for a weigh-in at his office. I had lost the weight I needed, and the surgery rapidly approached. Before I knew it, I was in the intensive care unit, feeling the most intense pain I have ever felt. The first day of surgery, I could not eat or drink anything. My first night, my mouth was so dry, and I was in pain. The next morning, I got an upper GI test to make sure there was no leaks in my new stomach. After that, I was finally able to drink water. On Tuesday, the doctor informed me that I needed a blood transfusion because my hemoglobin levels were low. I received my transfusion, and the next day I was released from the hospital, ready to start my new life. For the first week after surgery, I can only eat chicken broth, sugar-free Jell-O, and ice pops, water, and protein shakes. The next week, I could eat a little bit more, like cream of wheat and strained low-fat cream soups. The first week after my surgery, I lost 20 pounds, and I'm looking forward to my future on the loser's bench. The surgery style I got was a Roux-en-Y style surgery, which basically means the stomach is stapled, leaving the upper portion about the size of an egg. After the stomach is stapled, the surgeon cuts between the two sets of staples. The small intestines are cut from the old stomach and brought right up to the new small stomach. This style makes the intestines appear to look like the letter Y, hence the name Roux-en-Y. My surgeon does the surgery laparoscopically, which means instead of one large incision from sternum to belly button, just 5 or 6 small cuts are made with probes, and probes with blades and cameras are inserted in the abdomen. The surgeon watches the camera in the stomach through an eyepiece that shows the surgery. With this particular doctor, the surgery only takes about 2 hours, and 1 hour after the surgery, the patient is most likely up and walking. Most people are worried about the risks of this surgery, and like every surgery, there are. The most common include blood clots, stomach leakage, and in certain cases, death. The underlying cause for death from this procedure is simply this: inexperienced surgeons. General surgeons do not have the knowledge and practice needed to perform successful surgeries every time. My surgeon only does this surgery and the surgery's cousin, the lap band. He has performed over 900 bariatric surgeries and has not had any fatalities to date. In this quality of surgeon, he will tell you that from the first meeting he will become your lifelong friend because you continue to see him about 10 to 15 years after your surgery. Before surgery, my surgeon requires a 2-week liquid diet, which only consists of water, Crystalite, non-fat milk, cream of wheat, sugar-free Jell-O, sugar-free popsicles, low-fat cream soups, and fat-free broth. I must also take a protein shake, which includes 35 grams of protein per serving. This liquid diet serves 2 purposes. It clears out your digestive tract, but also breaks down the fat around obese people's livers, which makes it easier for the surgeon to find his way to the stomach. The day before surgery, you switch to a clear liquid diet, which is just the water, Jell-O, and sugar-free Jell-O and fat-free broth. This diet continues after the surgery as well. It takes about 3 to 4 weeks for somebody to become fully functional after surgery. You must learn to eat, drink, and live completely different. After the surgery, protein is your main source of energy, and you must consume 65 grams of protein a day, which is hard when about 7 bites of fish will fill you up. You must learn how to incorporate vitamins into your everyday life. At first, you can only eat about an ounce of food a day. You cannot eat or drink at the same time. After your surgery, you cannot eat any refined sugars, high-fat items like fried food, pastries, chocolate, soda, not even diet, or coffee, and some people's stomachs cannot handle other foods like chicken or cheese. These eating restrictions do not last forever, but it's better you stay away from certain things. In addition, women must use birth control for about a year after surgery, because after surgery, women who are not fertile before become extremely fertile. Men and women cannot smoke for a year.